want to welcome everyone out this morning. I think we'll have some people continue to trickle in, but this is our October monthly meeting for the Utah Children's Care Coordination Network, and we're so glad that all of you could join us. We've got some really great presentations lined up today, and a couple of case presentations as well, and hopefully we'll all get wrapped up by 10 o'clock. So on our agenda today, we are going to just go over some announcements and medical home portal updates, and then we'll go into our brainstorming sessions and case presentations, and then our presentations today are going to be by UPIQ, and then also the Family Support Center of Ogden, and we'll get all wrapped up and have just a few minutes for questions or comments at the end. So for welcome and introductions, I know before we used to kind of go through a lengthy introduction process. Now we're encouraging everyone just to use the features within Zoom to go ahead and identify yourself. So within Zoom, if you can scroll to the little, you'll see like a dot on the side of your picture. You can rename yourself with your full name and title and agency. That would be really helpful for everyone to know who you are. Again, if you're also able to join us with camera, we love to see everyone's faces. And as always, this meeting is very casual. Please jump in with any questions, comments you have. You can use the chat feature. You can use the raise hand feature. You could just unmute yourself and ask a question. So please go ahead and take just a minute to update your name and title on Zoom, and then we will get to know each other more that way. So for announcements, our fall pediatric echo series is continuing, and we have a couple coming up. I just listed there's one today on nutritional anemias, and then the Autism 101 series has been canceled for this time moving forward, but there'll be one on Prader-Willi on November 1st, and then a Bright Futures update on November 8th as well. So some good echoes to look forward to. Anyone is welcome to attend those if you want to learn more. The link there is available to register for them, and CMEs are available for those. From the medical home portal, we've had a couple of content updates I wanted everyone to be aware of. Premature infant follow-up, premature infant and retinopathy of prematurity, melanic acidemia, arginase deficiency. This is a new guideline, suspected neonatal seizure care. That's a newly published one. The others are all updates to content that was previously there. Critical congenital heart disease screening, and then integrative medicine for children and youth with special healthcare needs. So some really great content that's been updated. We encourage you to go look at if any of those topics are relevant to the work you do. And then we'll go ahead and do our case presentation. So today we have some people joining us from Utah Family Voices. And they are going to do our case presentation this morning. So I believe we have, is it Liliana and Elaine Christensen joining us from Utah Family Voices?
Yes, Eileen.
Great. And did Esperanza give you a little preface about the case presentation?
Ever so briefly, and I don't know if Lillian wants to go first, or if you want to just explain a little bit about it.
Go ahead, Aimee.
Hi.
I believe she said to go ahead.
Okay, so do you just want me to share some of the families we've worked with and how we helped them?
Yeah, so we're so grateful you could join us on this meeting. Typically we use this time to just bring cases to the group that either were difficult to solve or that they need some help solving, and then a little explanation of what the case was and what resources the parents were maybe directed to.
Okay.
Just as a way for everyone in this group to learn, first of all, more about resources and what to maybe do in a similar situation.
Okay, so one of the families that I helped, and this was last year, so we've, I think we successfully solved their dilemmas, but it was a family kind of living in a rural area, and they were an older couple. They had raised their family. I think they still had some teenagers at home, and were I don't know if it was a relative's child but they had taken in as a foster child with special needs, and they were in the process of getting adoption, and they just didn't know where to start with anything with I believe the child had cerebral palsy, and they were trying, first of all, the adoption was difficult. And so I had to do some research to help them know where to go. And then getting the financing, the Medicaid pieces in place once the child moved from foster care into their care. And then for the children they still had at home, they felt like a lot of their attention was going to the special needs child. And so I was able to help them know that there are sibling supports and offer those to them as well. And then and I got feedback from the family over the months that everything had been extremely helpful. They didn't know where to start, and it was so nice to be able to connect with family voices to know just to not feel alone. They were able to get their questions answered. And a family that I worked with just last month got a new diagnosis, and said she was a single mom and she needed financial help with the therapies that were going to be involved, which isn't an uncommon thing. And so it was a diagnosis of autism, and there are resources that can help with the therapies that are needed. And so I thought I was on the right track with her, and then she reached out again and said, let me know that their situation was much more dire, and what she actually needed was help finding even housing and being able to buy clothing for her child. And so it was more of a poverty situation that I hadn't realized in the first place. And so I was able to connect her with housing resources and entities within the community that can help with immediate needs, and get her the more immediate financial help. It wasn't just help with the therapies that she was looking for. So those were just a couple of cases that came to mind, and I'll let Lillian share some as well.
Before Lillian chimes in, we'd love to actually hear if you remember some of the specific resources you referred both the first and the second family to. This again is just a great opportunity for people to hear more about specific resources in the community that are available.
Certainly. So for the first family, some of the resources, and I can put them in the chat. Would you like that?
That'd be great. Sometimes we look them up on the medical home portal as people are talking about them, so that they can see what the listings look like on the medical home portal as well.
And as I do that, I connected the first family with the adoption. And I'll get Okay, so I let them know about a monthly subsidy for adopted children. And then I also, I thought I had, hold on just a sec. I meant to put these in there too. So I will just tell you, because you probably know all of these. So I put in sibling supports from the Utah Parent Center website, DSPD resources, and I let them know about the Medicaid waivers, and also the Medicaid medically needy bend down. I let them know about several respite resources, like Baracare and child care for families with significant disabilities. And then I sent them the CP supports. Would you like me to put those in the chat as well?
Yeah, any specific resources you shared with them are great. And then we also compile a list and send them out to everyone at the end of the meeting as well, so that they can, if something like this comes up for them, they can maybe have a good list of resources to go to.
Sure, absolutely.
Great.
Let me put this in really fast. And so that was to help them with the CP issues that they were taking on as a family. I can only imagine jumping in, you know, it's one thing when you have a child and slowly learn that they have a disability and you kind of grow into it, and to adopt a child all of a sudden they have all these needs, you really would feel so lost. And then let me see if there was one more for that instance that might be helpful. And these are all probably things you're already aware of, but it never hurts to share just in case. And I apologize, I was only told briefly about this meeting.
No,
So
you're fine. That's great.
Okay, so those are some of the
policy projects.
Yeah, so those are some of the things I shared with that family. And then
and as you're thinking about the second case you shared too, I just wanted to highlight on the medical home portal, I have it pulled up here now, where if you do search specific topics, like for example, cerebral palsy, you can see that there's topic pages that are going to come up, but you can also filter down for families or professionals. So in this case, if you were looking specifically for information for families, there's a page that's written that's more family focused for families here. It's got kind of some frequently asked questions, and these can also be translated into any language through Google Translate on the top. So just a great reminder too, that there's a good resource there for information on medical conditions.
And I'm looking for what I sent the mom, the resources in the community to help with housing. So if Lillian wants to go ahead, and then I will put those up on the chat as soon as I find them.
And Lillian actually jumped in that she had to excuse herself. She had a family emergency. So
okay, if you want to be patient with me, I will find.
That's you can continue to look for them and put them in the chat. But we'll maybe move on to our brainstorming section while you're doing that, if that's all right. So for brainstorming, again, this is just open to anyone. If you have had a difficult case or some questions or heard of a new resource or event that's happening that you think would be valuable for this group to know about, this is the time to go ahead and share those things. This is a group effort here. So I'll just go ahead and mute myself for a second, and anyone can jump in with anything they would like to.
So this is Natalie, and I'm asking this question for my care coordinator, Gwen Anderson, who is actually out of town. We have a little guy who lives with his grandma down in the Price area, and the grandmother also cares for her mother. So the child has autism as well as hyperglycemic and hyperglycemia as well as global delays. So he's quite a complicated little guy. The problem is this grandma that cares for, she's sandwiched between caring for two generations. Her mother's been put in ICU. We were able to quickly find a placement for this 4-year-old grandson at the Justice Center. It was an emergency placement. We got it at Gwen. I say we, but I mean Gwen. Got it approved for 72 hours. And then within 24 hours, he started throwing up. And I'm assuming that that's related to his hyperglycemia. He's very difficult to manage. So anyway, now the Justice Center won't keep him. So we are just wondering if anybody might know of an emergency place that we can find a little bit of respite for this grandma while she's trying to care for her mother who is in ICU. And her mom might have already been transferred to Provo. Anyway, just looking for emergency care for a child that, you know, has some complicated medical needs.
Great question, Natalie. Anyone have any resources for her?
Natalie, how old did you say the child was?
He's 4.
He's 4. Natalie, so I'm Maria with the Sammy Center. And I mean, I'd love to connect with you or connect with the family and see what we could do.
Perfect. Do you want to give me a phone number and I'll get it to Gwen, or I will reach out to,
And yes,
that'd be great.
so my phone number, can I give it to you now? Is this a good time?
Sure.
I put it in the chat, but I'm kind of having some technical difficulties, so forgive me. It's 385-420-4991.
385-420.
4991.
Okay, perfect. Thank you.
Yeah. Okay. Thank you, Natalie.
This is great. This is the exactly kind of sharing we hope to see during this portion of the meeting. We also had someone post a question in the chat. This is from Natasha Kelsey, and she was asking if anyone knew of any Christmas assistance programs in the Salt Lake area that are still open for families that are low income. So some holiday help for families in the Salt Lake area.
Hello, good morning. We are starting our giving tree for the holidays here at the Utah Parent Center. So a family in the Salt Lake area, low income, that would be a wonderful addition to our list that our parent consultants put together. So if you want to connect, you can email or call me directly and we'll make sure the family makes it onto the list.
Hi, this is Heather Carlson. The Salvation Army is doing Angel Tree until November 4th.
Great, and we'll make sure that all of these go out on the resources as well. So I just used the search term holiday help here as well in the medical home portal, and it came up with the contact for Salvation Army, there's a few others as well. It looks like that if you zoom into the Salt Lake area, you can find a few other options. Salt Lake County Youth Services, it looks like. And that one's probably not a holiday one. I don't know what's going on there. But we'll get the contact information for those out as well. And it looks like we have a few hands. Go ahead, Carrie or Eric, whoever wants to jump in first.
I was going to say that the Angel Tree applications and like the Salvation Army, they have a little blurb on their page that says parents have to apply in person October 2nd through October 14th. But I am guessing because of how wonderful the organization is with working with parents, if the family community contacted them, I bet there would be an exception made.
Thanks, Carrie.
And then I just wanted to ask Esperanza if there's a way that we can connect to be able to help the families that are on the tree parent center. So if we could have a connection for that, possibly, if you would reach out to us, I'd like to be able to, talk to my family and see if there's any way that we could, contribute to that.
Absolutely, Eric. I'm not sure if you guys can see me or hear me. I tried to unmute myself before. Okay, great. Yes. So we are getting started with that process. So I think connecting, I'll reach out to you after the meeting.
Sounds great. Thank you very much.
Absolutely.
And I've added into the chat the resources for the mom that needed some basic needs met more immediately.
Perfect. I saw those and I'll get those added to the notes too. Somebody also put in the chat, looks like Heather dropped in the chat that Toys for Tots is also open until December 6th. And you just need a valid ID with and a birth certificate for that program as well for the holiday help question. Okay, these are all super. I'm trying to scroll through the chat to make sure I didn't miss anything. Has anybody else had any thoughts come up with resources around emergency respite or holiday help that we haven't mentioned already?
I just compiled some respite resources, so let me put those in there too.
Okay, great. Super. Well, this is a great brainstorming session. We love to hear your questions and we love to hear all the resources that are available. And like I said, we'll make sure we compile all these. They always go out on our resources of the month email. So keep an eye out for that. If you weren't able to write down everything during the meeting here, we do make sure we get it all out to you after the meeting.
Athena, can I just make one little announcement? I'm Maria. Good morning with the SAMI Center. And I just want to let anybody know that we are a social emotional preschool, 3, 4, and 5-year-old children. If anybody has a need for preschool services, specifically children that, we are neurodiverse, typical and neurodivergent. So if there's a need for that, please send them my way. And I'd love to meet with any family who's interested.
Great. Anyone else have any thing they want to share? Okay, we're going to move on to our presentations. Like I said, we have 2 today. So the first portion of these presentations we'll hear from UPIQ. And they are celebrating 20 years of Utah's Pediatric Partnership to Improve Healthcare Quality, also known as UPIQ. So we will turn the time over to Gabi, Heidi, and Aimee.
Great, thanks, Athena. So if you put up the slides, that would be awesome. Okay, great. Well, thanks for giving us the opportunity to highlight UPIQ today. So Heidi is out sick, so I will talk about her portion, what she was supposed to present, and Aimee is in a call. And just a quick introduction. So UPIQ, the team is Dr. Diane Liu. She's a pediatrician at Sugar House Pediatrics and University Pediatrics. She's the director of UPIQ. Then we have Heidi Bates. She's one of our QI coaches, as is Aimee. And then it's myself. I am the associate director of UPIQ and also a QI coach. All right. All right. You want to go to the next slide, please? So we have nothing to disclose, which is probably good. Go to the next slide. Thank you. So our objectives for today is giving you a little history about UPIQ. And then also we want to touch on the current projects, what we are doing. And then if there's a little bit time in the end, we have we can do a Q&A, or if you are interested in joining us, we can let you know how to do that. Okay, next slide, please. All right, so 2023 is a big year for us. So we are celebrating 20 years of UPIQ. Yeah, that's great. On the left, you can see our old logo, and some of you, like Eric and Athena, probably still remember that old logo. And on the right, you see our newest logo, and since 2015. And I like this logo much more. It's more contemporary looking and sleek looking. Yeah, next slide, please. Okay, so how did UPIQ come about? So in 2003, Dr. Young and Dr. Glade highlighted the need for improved approaches to child health in a community setting through practice-based research and quality improvement. So they recognized a duality in practicing medicine, both the uncertainties that often exist in knowing what to do for a patient, as well as confronting barriers that is preventing us from delivering what we know is best for a patient. So those are two gaps, the gap between what we know and what we don't know, and the gap between what we know and what we do. And also Dr. Gordon Glade and Dr. Paul Young, they're both pediatricians. They are now retired. Dr. Glade was a pediatrician at Utah Valley Pediatrics, and Dr. Young was the pediatrician at the Utah University Pediatric Clinic. All right, go to the next slide, please. So what was their solution? So they mentioned collaboration. So nowadays, when we hear the word collaboration, we take it for granted, but 20 years ago, it was an exciting idea. So they believed that collaboration would yield to better study designs and study questions. Next slide, please. So in 2003, when UPIQ was formed by Dr. Glade and Dr. Young, so as a state improvement partnership with the following stakeholders. So stakeholders were the Utah Department of Health and Human Services, also formerly known as the Utah Department of Health, the Utah American Academy of Pediatrics chapter, Medicaid payers, Department of Pediatrics, Intermountain, Family Voices, and those are just a few I'm listing here. And then UPIQ is also part of the National Improvement Partnership Network, which is a network of pediatric quality improvement partnerships throughout the United States. The headquarters is in Vermont, the University of Vermont, and the QI coaches from all those organizations, we are meeting monthly to talk about current projects and to learn from each other. All right, next slide, please. All right, I think there might be a slide missing. Okay. Oh, yeah. All right. So we also support priorities from our stakeholders. So Eric, who is on the call today, is the director of the Integrated Service Program. So in 2009 and 2010, we received a 5-year CHIPPER grant for the medical home demonstration. Athena, I'm sure you remember that project because you were working as a care coordinator there. So one big part of this 5-year-long project was to integrate care coordination into primary care. Part of the grant was used to support practices in hiring or training existing staff to be care coordinators. So that was the introduction of care coordination in pediatric practices in Utah. So 12 practices signed up for that 5-year-long project. And care coordinators would meet monthly over Zoom for some didactic learning, networking, and problem solving. It sounds pretty familiar, right? Next slide, please. Well, and you're correct. So those meetings were a precursor of the Utah Children Care Coordination Network, the UCCCN. So after the CHIPR grant ended, Dr. Chuck Nolan, who used to be our medical the director of UPIQ, formed UCCCN, and he was open to everybody in Utah who is interested in care coordination. So it used to be led by Mindy Thüler, and now is led by Athena Parker and Michelle Redfield. And again, you know, we're meeting monthly, we're doing brainstorming, problem solving, didactic learning. So it's pretty much what we did during the 5-year CHIPR grant, we still continue to do it now. All right, next slide, please. Of course, we cannot forget the medical home portal. That also came out of the CHIPR grant, you know, so there were resources put into creating the medical home portal, and it's still going strong today. And I don't need to say more about it because Athena already demonstrated just a few minutes ago how it's been working. All right, next slide, please. All right. So here I want to show you some of our work. So this timeline represents from 2003 up to current. So each one of those colored tiles represents a QI collaboration led by UPIQ, by us, and in partnership with a number of community organizations and stakeholders. So you can see we have been quite busy over the last 20 years. And if you look at, and I know it's a little smaller print, but if you look at the tiles, so some of those QI projects actually going, you know, they can go up to almost 8 to 9 years, like the immunization project where we partnered up with the CDC, or asthma. So we did our first asthma project in 2006, and then started up again in 2013, where we partnered up with the Utah Asthma Program at the health department. And it's still going on currently. So we're still enrolling practices on that one. And then other projects, they are more the traditional style, where we have 9 to 12 months, like ADHD, autism, oral health. And there is also, you know, reoccurrent projects like ADHD we did in 2015, and then also in 2005. Yeah. Go to the next slide, please. So what do? We do facilitate quality. So foremost, we facilitate quality improvement in primary care, and this is also known as practice coaching. So we work with primary care practice teams across the state of Utah within various health systems. So it can be a large health system like Intermountain or Wasatch Pediatrics, Utah Valley Pediatrics, and also down to very small pediatric practices, such as BCP Pediatrics or Color Country down in Cedar City. So it's quite a variety of practices we are working with. So what is our aim? Well, our aim is very, very simple. It's to help practices to improve the care they deliver. So ARC, the Agency for Healthcare Research and Quality, has done several studies on this and shown that practice facilitation is an effective strategy to improve primary care processes and patient outcome. And then I also would like to point out that we also create an ongoing trusting relationship between ourselves and primary care practices and community organizations. Community organizations such as mental health organizations or other community organizations. All right, next slide. So we at UPIQ, we followed a model for improvement, the IHI model for improvement. IHI stands for the Institute for Healthcare Improvement. So, and we are following this model the past 20 years. So it was implemented in 2003, and to this date, they're still following the same model. And there's 2 phases on those models, and I'm sure you have heard me talk about this in the past already. So the phase 1 is, that's when you ask yourself 3 very important questions. So what are we trying to accomplish? How will we know that a change is an improvement, also known as metrics of measures? and what changes can we make that will result in improvement. So this is the first phase. And the second phase is the PDSA cycle, the plan, do, study, act cycle. So that is where we test the interventions and then also study the outcomes. Next slide, please. Well, so this slide shows a typical structure when we form a QI effort with practices. So as you can see, there's different phases. So there's the pre-enrollment phase. So that's where the practice enrolls, registers for the project. Then there's a pre-engagement phase that's where the QI coaches, where we go out to the practices, meet the team or build the team within the practice, talk about the project. And then there's the engagement phase, which is usually up to between 6 to 9, 12 months, sometimes even longer. And during that engagement phase, that's where you see all the PDSA cycles occurring. There's also some didactic learning. There's team lead calls where practices learn from each other. And then there's a 6 months post-project phase where we leave the practice alone for 6 months, go back in it, and see if they were able to sustain the gain they had during the engagement phase. So if you look at this slide, it looks pretty linear, like that, our project it's kind of a straight line. However, if you go to the next slide, please. That's what it really looks like. Okay, that's really how quality improvement really looks like. So we have a start date, a start and an end, and what happens in between is kind of a roller coaster. It can be very straightforward, but most of the time it is an up and down. It's really a spaghetti. It can look pretty messy, but that's where UPIQ comes in and really helps the practice to navigate through that mess. Okay, next slide, please. Okay, so how big is our reach? So over the past 20 years, so we have currently 13 stakeholder organizations on our steering committee. We have engaged over 200 practice teams over the past 20 years. So we had 300 plus providers involved with UPIQ projects, and providers also can receive MOC Part 2 and Part 4 credits and CME credits. We had 25 plus different topics addressed in these 20 years, and we delivered 40 plus collaborative. Remember, we had several topics repeated. And we worked almost in all 29 counties in Utah. And our future goal is actually to expand ourselves out into our neighboring state, specifically Colorado and Arizona and Nevada, the little rural practices that are right on the border between Utah and the neighboring state. So that's our goal for 2024. All right, so how well does UPIQ facilitation work? So in the next couple of slides, I would like to highlight some of the strengths. And those slides actually were shared at national conferences. The first one I would like to highlight is our childhood experience, the adverse childhood experience, or also known as toxic stress QI project. So this was done in 2014. So if you look at the first graph, or actually look at both graphs, it's pretty exciting to see that how early on practices implemented a screening tool, and we're actually able to follow up on children who screened positive for toxic stress. So the first measure, % of patients screened, you could see within 3-4 months, practices hit the goal and were able actually to sustain up in a high 70 percentile. The second measure is the follow-up. Once a child screened positive for toxic stress, as you can see, it took about 3 to 4 months to implement the process on how to follow up on those children, how to connect them with our community resources. And once that was in place, practices really took off. I mean, 100%, the lows were 75%. And you can see the last 3 months of the project, they really sustained the goal and the gains. And I also want to highlight here Dr. Neil Davis, for the ones who you don't know Dr. Davis. So he's a pediatrician at Hillcrest Pediatrics in the Mountain Group. And he was the champion for the toxic stress QI project for Hillcrest. And he was so engaged, and he really realized or recognized the importance of screening for toxic stress. And he advocated for all the Intermountain practices to do that. And since 2019, every single Intermountain pediatric practice is screening for toxic stress at the well-child visit. So it's part of the intake form, part of the well-child visit, in addition to the depression screening and the anxiety screening. So that was really, really very powerful for us to see the impact. And then also the Intermountain came out with the toxic stress or adverse childhood experience care process model. It's quite extensive. It's, I think, 20 or 23 pages. But if anybody of you is interested to have access to that one, I can reach out to Dr. Davis and get it for you. All right, next. Oh, yeah, thank you. So our ADHD QI project was done in 2015 and 2016. And so here, I just would like to highlight the numbers of metrics participating practices we're willing to look at. Metrics is that are measures. And, whoever has done drug reviews knows how onerous this process can be. And that's one of the reasons that UPIQ, contains these metrics or measures maybe to 2, max 3 metrics per project. But on the ADHD project, I think there were 6 and plus metrics out there. And practices are willing actually to go along with that. It was amazing. And you can see successes and then also where we struggled. For example, using a formal screening tools, hence the Vanderbilt, for example, on the new ADHD visit is doing very well. Starting with the project, they were about 60%, by the end of the project was up to 100%. However, using a formal screening tool at the follow-up visit for ADHD was a struggle. It's the first measure in the second row, was a struggle in the beginning and continued to be a struggle throughout the project. And I believe to this date, it's still a struggle. Okay. So next slide, yeah. And then also the asthma stuff. So, I mentioned, remember the timeline, and then asthma is already going on since 2013. So the last 10 years, we're doing asthma projects. And I just here want to show the table on the past, the practices who joined us from 2017 on up to 2023. And if you look at the baseline, which is, we always ask for a baseline before we start a project, you can see the baseline is actually pretty low. And by the project end, you can see there is quite an improvement. Except 2019 and 2020, you can see that the project end, we really nosedive down to 38%. But I would like to point out, this was the COVID time, right? It was the height of the COVID. So everybody was struggling, but people, practices stuck with it. And then 6 months following project, they were already up to 50% again. And some of the practices, they recognized the need of rejoining the project in 2020 and 2021 and actually improved very nicely. So here we can really see the COVID. This was this measure was using a standardized tool to assess asthma control. And the second one, the slide that's up right now, it's using an asthma action plan or providing an asthma action plan to the family. And also here you can see baseline and then project end and also 6 months follow-up data on here. And, the asthma action plan is always kind of hard, or in my own experience, working with practices on the asthma project, it was always difficult to come up with a process, a reliable, sustainable process of giving asthma action plans to the families. There are several providers out there who don't think it's necessary. Then other providers put it in the after visit summary and print it out, but then they find it in the garbage can outside the clinic. So it is a struggle, but we keep working on that one. All right. And as I mentioned, current project, one of them is the asthma project. We're still accepting newcomers. So if anybody of you knows of a clinic or, you work in a clinic who thinks this might be beneficial for the clinic to participate, please reach out. Heidi is the QI coach on that one. She's out sick today, but I think Athena is going to put the contact information in the post meeting notes. And yeah, that's it. Next slide, please. And then, of course, I have to mention the prescription for play. It's also an ongoing QI project where we partnered with the Lego Foundation for this year, and we're in a process of actually extending the funding for next year, where we partner. So we partner the Lego Foundation, but we work with primary care pediatric or primary care providers to implement implement education for the parents or caregivers on the importance of play with the child for 50 minutes a day to help to develop their social, emotional development and also the brain development. And this project is geared to 18 months up to 36 months old well-child children. It's a very fun project. Again, if you know a clinic who would benefit from the project, or you would like to learn more about it, please reach out to me. And with that, I'm going to give it over to Aimee, who's going to talk about her project she's doing right now. Thank you so much for listening to me.
Hi guys, can you hear me okay? Okay, perfect. Thank you. Thanks so much, Gabi. So I work with what's called the Aspire team. Aspire stands for Autism Services, Personalized, Integrated, Research Informed, and Empowering. And the group that I work with are some developmental pediatricians, psychologists, speech therapists, and others who our focus is on identifying children on the autism spectrum and then opening those doors to getting them into treatment, because statistics show that children who are on the autism spectrum who get into treatment sooner have much better outcomes, which is no surprise to anyone who knows anything about healthcare and statistics, right? So with those efforts, there's multiple arms of Aspire and multiple projects that we're working on. Currently, we're doing the Autism 101 Echo, which, as you heard, was canceled for October, but we are also conducting an Advanced Autism Echo as well. And this Advanced Autism Echo is to train primary care providers in an autism assessment tool called the STAT, and it is a secondary screener. So the idea is that these primary care providers would do an initial assessment, and that would come back questionable or the child would fail, and then they would move on to the STAT. Once they have done the STAT and given a definitive diagnosis of autism, then that diagnosis stands, and insurance companies have agreed that these providers who have gone through this training are capable of diagnosing autism. Now, in this process, what we've done is we allow these providers to, what they do is they do their STAT, but then right now, while they're still learning, they send those children on to our team, who does kind of a confirmation. Yep, this child definitely has autism. We agree with you. Or if the primary care providers are unsure of the diagnosis based off of the STAT assessment, then they can send them as well for a full assessment by our team to get that child diagnosed, or not diagnosed with autism, but maybe something else, and get them the services that they need. Currently, we have 10 primary care providers who have been trained in the STAT, and through their process, we have been able to confirm diagnosis for 15 children that they have screened. And then we just confirm those diagnoses. There have been other children that we are working with to do the full assessment and to figure out what's going on. We've also started a group called CAP. CAP stands for Connecting Autism Parents and Providers. We're big on acronyms in Aspire. And the CAP program is quarterly meetings where we bring in people who have loved ones who are on the autism spectrum. So parents, grandparents, friends, neighbors. And our expert panel provides them information about autism, about resources, about how to talk about autism, what autism looks like, all those kinds of things. But then additionally, it provides a networking opportunity for these families to be able to, kind of connect with people who are living a similar, not exactly the same, but a similar experience. And we found that networking really, really helps to strengthen the group as a whole. So it's been a great benefit. We had our last meeting in September. Our next meeting is in December. So if you go to the next slide, this is our flyer for our next CAP meeting in December. It's going to be on navigating autism supports, including interventions, the landscape of autism, and building confidence and competence. The primary children's hospital child life team helps us with child supervision so that if you have a child on the autism spectrum and wouldn't be able to come otherwise, there is a resource for those parents and it is free. We hold these meetings in person at Primary Children's. We've battled back and forth on whether to do them virtually or in person. And right now we feel like the in-person module is the best way to get this information across. There is a QR code. That is the registration link. And that just tells us, you know, who are you in relation to the person on the autism spectrum? Are you going to be bringing children? What kind of supervision do they need? What's your email address so we can send out resources afterward, those kinds of things. So if you are interested, I can make sure that that's available to send out to whoever would like it. We want to get as many people there as we can. We want to spread this as far and wide as we can. Okay, next slide, please. So the other thing we've started is what we've called WAGE, again, with the acronyms. WAGE stands for Work for Autistics Gainful Employment. And what we are doing is we are working to partner with organizations like Vocational Rehabilitation, University of Utah, any other interested employers to see how we can break down barriers for employment for people on the autism spectrum. The Aspire team has hired 2 self-advocates in an effort to show that hiring people on the autism spectrum is not only possible, but actually provides huge assets to our group. And so we want to be able to break down any barriers that other employers might have to hiring people on the autism spectrum. So we want to create a network and information to help people to move forward in this process so that people on the autism spectrum can be employed and in whatever field that they feel like they would excel in. So this is just in baby steps right now. We're just setting up these meetings and getting started, but we're really excited about the potential about helping people in the spectrum get employed. And then we are also, again, baby steps, starting what we're calling a rapid diagnostic clinic. What this will be is multiple providers will all meet together at the same time with the child so that they can all come together, bring in their expertise and experience. And that way there's not multiple visits. Now there's only certain types of children that qualify for this type of visit. And right now we're not, what's happening is our scheduling team is pulling those children. They run an algorithm and say, okay, these people might work for the rapid diagnostic clinic. And then they will contact the parents to see if that's something they're interested in doing. So there isn't a way to like directly refer to the rapid diagnostic clinic right now, but eventually the idea is if this is successful, and it has been successful in other facilities across the country, but if this model is successful, then we want to open it up to, we can refer right to rapid diagnostic clinic. So that's kind of what Aspire is working on, and it's a very exciting field to be in, and I'm very excited to be a part of it. Thank you.
Great, thanks so much, Gabi and Aimee. We've got their contact info here, and like I said, we'll be sure and send that out after the meeting as well in the notes. Does anyone have any questions for Gabi and Aimee about any of the current projects that are going on, and or any of the history that Gabi presented for us?
So if our Lego project gets funded for 2024, I will definitely reach out to everyone on this call to see if we can actually connect with practices in your area, just to let you know.
Thanks, Gabi. All right, so our second, whoops, sorry, my mouse is going crazy all of a sudden. Our second presentation today is going to be about the Family Support Center of Ogden, and we have Madison Steele here with us today. to tell us a little bit more about them and what they do. So I'll go ahead and turn the time over to Madison.
Awesome, thank you. Like she said, I'm Maddie. I'm at the Family Support Center in Ogden. And I'm just going to give a presentation about our services. So a little bit about us. We are a nonprofit, and we'll talk about our mission in the next slide, but our goal is really to help families in the family unit as a whole. A lot of our services are preventive services, but we also work a lot with families who are involved with open cases with DCFS. But it's free services for anyone in the community. There are family support centers all throughout Utah. So there are ones in Salt Lake and Logan and down in St. George and Cedar and things like that. Our location specifically is in Ogden. So I'll be talking about the Ogden services. Okay, so our mission is providing education and supportive services to strengthen the family unit and enhance family functioning. We've been around for over 40 years, and we have been helping families that are, like I said, involved with, if there's been abuse or neglect in the home. We work with a lot of families that are involved in that, whether that's a family trying to keep their kids, or if that's a family trying to, the goal is reunification. We support a lot in that, but we also support day-to-day families that aren't necessarily having these issues, but just need a little bit support here and there with parenting, or just need a break. Watch this video, but I'm just going to kind of touch on it a little bit. We have been talking a lot about protective factors and how they help families a lot with working through some of their things. So each of our programs that we offer, we try to implement or include protective factors in each of those to help build protective factors in families. So not each of our programs don't hit all of these, but each of them hits at least one. So just as if you guys are unfamiliar, the protective factor, there's nurturing and attachment, knowledge of parenting for child and youth development, parental resilience, social connections, concrete supports for parents, and social and emotional competence of children. You can hit the next slide.
Okay, did you say you wanted to watch the video clip or skip it?
No, we can skip it.
Okay.
Okay, so on this slide, it has all of our services on here. We have a slide for each of the services, so I don't spend all the time on this slide talking about each of our programs. We'll go in detail about each of them. On this slide, it's just an overview. Most of our services are free and available to everyone in the community. We do have a couple services that are still free, but the parent or caregiver has to have an open case with DCFS to get a referral, and then we can provide that free service. But these are our free services. So we have short-term childcare for anyone in the community. We have family education classes. Some of them are parenting classes, some of them are classes for the entire family, and some of them are classes just for the kiddos. And then we do have an advocate and referral line that if we don't provide services for that the family is requesting, we can refer them to other agencies and help them kind of along the way with that process. We can go to the next slide. Thank you. Okay, so we'll talk about our childcare options first. This is a huge asset. Families love dropping their kids off here. So it's free childcare for 2 hours at a time. We can only have kids up to age 11. That's just what we're licensed for, 0 to 11. Our staff to child ratio is 1 to 4. So we typically have 2 staff at a time. So for any 2-hour appointment, we can have 8 kids at a time. So we do get filled pretty quickly. But while the kids are there, they have activities, games, crafts. We offer them a snack or a meal, depending on the time that they come, or if their family is, like if they say that they've already eaten, we're not going to give them another meal, we'll give them a snack. We also have an outdoor play area. All of our staff are trained and trauma informed, so that helps them manage some behaviors that come up due to some of the crisis that the families are involved in that we work with. But again, although I do work with a lot of families who are involved in crisis situations, not everyone we work with is involved in a crisis situation. It can really be anyone who wants to use this service. For scheduling, we can schedule up to 24 hours in advance. So you can't call like a week in advance and say, hey, I have a doctor's appointment in a week. Can I drop my kids off for 2 hours? But you can call the night before or the day before to schedule that appointment. Typically, if you call within that window, you can get a spot. The longer you wait, the less likely you are going to get a spot. And we have had families do like walk-ins day of and say, hey, do you have availability to take my kids right now? And we have been able to do that as well. It just depends on the day. But like I said, they're 2-hour appointments and we can do 2 of those per week per family. There's no eligibility requirements or questions asked to why the care is needed. So it's not, like I said, it's not for just crisis situations. If someone is tired and wants to take a nap, if they want to spend 2 hours and go to lunch with a friend, if they want to go get their nails done, or just sit and do whatever, clean the house, whatever, without children there, it does not matter. We're here for a safe place for kids to go for free for any reason. The only reason we would not take a kid is if they are school aged during school hours, because we want them to be in school, or if they're sick. We just don't want to get staff or other kids sick. We are open to families in Morgan and Weber counties, but we do take other families if they live in different areas, case by case. So this might look like if there's a family that lives in Salt Lake, but they have a doctor's appointment up in Ogden, and they wanted to drop their kids off for that doctor's appointment, we would take those kids because they're coming into our county. The reason why we specify this is because, like I said at the beginning, there are family support centers throughout all of Utah. There's 11 throughout Utah, and each of the family support centers has this program. Not all of them are titled Kids Zone. Some of them are titled Crisis Nursery. Some of them just have their own unique names, but they all are the same child care options. So we would refer a family to the family support center in their county if they don't live in Ogden. But that's the Kids Zone. It's awesome. The staff are great. Our families love dropping the kiddos off. We have a lot of families who use us repeatedly. And the goal there really is prevention of child abuse, and just easing family stress overall. Okay, our next program that we're going to talk about is Adoption Respite. This program goes along with our Kids Zone. So it's pretty similar in what we offer for Adoption Respite. The only difference, well, there's 2 differences. For Adoption Respite, there needs to be at least one child in the family who is involved in foster care or has been adopted through foster care. If there's at least one child who fits that criteria, all of the kids in the family can use our Adoption Respite. The difference between Adoption Respite and our crisis or our Kids Zone is that they can have 3 appointments per week instead of just 2. And that 3rd appointment can be scheduled more than 24 hours in advance. So currently what we're doing is our Adoption Respite days are on Mondays and Wednesdays, and families can plan that out a week in advance and can choose if they want to come in on Mondays or Wednesdays to have that planned respite, which is huge when you are a foster parent and dealing with some potentially hard behaviors to manage. Seeing that you have those options of a planned respite, even for 2 hours at a time, is really beneficial to help families keep going and keep their morale up. So again, just a reminder, they get food while they're here, whether that's a meal or a snack. They have our ratio is 1 to 4 still. No eligibility requirements outside of being involved in foster care. Can't take kids during school hours or if they're sick. And we're open to families in the Morgan and Weber counties, but talk to families case by case and do have the capability of taking more as needed. Okay, So moving along to our parenting classes and family education classes. I'll talk about our parenting class first. So we use the Nurturing Parenting curriculum, and this focuses on developing positive connections between a child and their caregivers. So this is evidence-based, it's hands-on, so we do activities during class as well as just education. And it is court approved. So if a family is involved in a situation that they are required to take a parenting class, or if they just want to, it doesn't matter. They can come to our class, and we do have a certificate that they can show to show that they have taken a parenting class that works for the program. This can be attended by any family in the Weber-Morgan area. Again, it's the same situation. Each of the family support centers also offer this parenting education class. We just offer it at different times and in different ways. So that's why we would refer to a different family support center if they lived in a different area. With that being said, we had a parenting class just a couple months ago that we had 3 moms who came from Salt Lake, and they signed up and they wanted to make the drive. So it wasn't an issue. We didn't turn them away. This parenting class, it's just for adults, but we do offer a youth development class at the same time for children 6 to 17. It's a different curriculum, and we're going to talk about it in the next slide, so I won't go too in depth with it. But we offer it at the same time as the parenting class so that the adults can get their class, and the kids can also be learning something to help them improve while the parents are there, so they have a safe place to be. If parents don't want their kids in the class, that's okay. We also have our kids zone open during parenting classes, so the kids can go there and have a safe place to be while parents are in class. And we do offer meals every week for class. Again, all of our services are free. There's nothing that nothing that parents need to show or pay for our services. Our next class, oh, sorry, I was just going to talk about blended family really quick. Our next class is our blended family class, which is a step family class or a co-parenting class. So a lot of our families that use this class is for the entire family. And a lot of our families that use this are that have been together with someone and separated for whatever reason, and are either starting a new relationship or they're learning how to co-parent between 2 separate households. They don't necessarily have to be in a new relationship to have this class. It can just be parents trying to co-parent with different rules, different boundaries, things like that, which is super hard and super confusing for everyone involved. So for this class, the difference with this is there's an adult class that has their curriculum, and then we have a teen class and a youth class at the same time. And the curriculum is all the same. It's called STEPS, and they go over very similar topics. The adults have, you know, adult themed stuff. So they talk about legal issues, finances, communication, things like that, where the kids talk about building relationships while maintaining previous relationships and expectations that might be happening with their families and big emotions and how to work through those. But they all come together at the end and do a family activity together that is focused on a topic that they discussed in class that might be a little bit hard to discuss independently in their own family. So we have a safe environment for them to talk about some harder topics that are really important to address. Again, this is evidence-based. We provide meals during class, and the young kids, if they're not in one of the classes, they go in our kids zone. So those are our education classes for adults. Okay, now we have our youth resiliency class. We have a lot of programs, so I'm just kind of throwing at you, but if you guys have any questions, we can answer those as well. Our youth resiliency or youth development class. This is the one I was talking about that we offered during our parenting or nurturing parenting class, but we also offer it individually. It's on Mondays from 3:30 to 5:30. Our parenting education classes are 5:30 to 7:30 on Wednesdays and Thursdays. But this program is for kids ages 6 to 17. We have a youth class and a teen class. And it's really there to help children learn to manage their emotions and work through difficult behaviors and build resilience. These classes are 6 weeks long, and parents drop their kids off and then pick them up. We provide a snack while they're here. Some of the topics that we discuss are positive relationships, responsibility, self-efficacy, identity, choices and consequences, resiliency, things like that. So it's really just a safe place for them to grow in their social and emotional development. We can go to the next slide. Okay, the next 2 slides are going to go over our in-home programs that do require a referral through a caseworker, so an open case at DCFS. Again, they're still free. We just have to have a referral through a DCFS caseworker. So we have peer parenting, which we've been doing for years and years and years. This is individual one-on-one parenting education. An educator goes into the home of the family and they work through a curriculum and they teach skills and education on parenting, relationships, communication, all of those things. But they also do individualized goals with the family that they come up with together. So this might look like a financial goal or a health goal or something like that. This program lasts 4 months, so it's pretty intensive and it's really one-on-one. So it helps identify specific needs and behaviors that families have. So it's really great, where our parenting class is kind of like, it's more broad because there's a variety of people who are in the class. So you can't target just 3-year-olds or just teenagers. You have to kind of hit all of the options, where peer parenting, since it's one-on-one, you can just focus on what the family needs. Meetings are once or twice a week, 1 to 2 hours at a time. This service is provided from North Salt Lake all the way up to the Idaho border. So we have educators in the home through that whole area because we're one of the only providers that offer this specific program. Okay, and then we have our Safe Care program. This is also in home, also needs a referral from a caseworker, open at DCFS. This one is a little bit newer. It's specific to children 0 to 5 who are either at risk for or have a history of child neglect and or physical abuse. The 3 key outcomes for this program specifically is parent-child interaction, basic health information, and home safety. So there is a little bit of a difference with this. The parent or the educator goes in with the parent and educates them on these things, but they also monitor how the parent is interacting with the child during these meetings to see how they're improving and how they are working with the child, the parents working with the child, and they can work with them in the time that they're there to change behaviors and things like that. Again, it can be 4 months, but it can also be longer than 4 months, once to twice a week for 1 to 2 hours from North Salt Lake all the way up to the Idaho border. Okay. And then our family advocate piece, this is also our referral line. Anyone in our community can utilize this. Anyone who calls can utilize this. And this is a service that we have a lot of families that we work with, and we have a lot of agencies in Ogden that we partner with. And we get calls or walk-ins pretty frequently asking us for services that we don't provide. A lot of our services are education and skill-based or crisis breaks. But we get a lot of requests for financial help, housing help, medical help, things like that we don't provide through our agency, but we partner with different agencies who do help with that. So our family advocate's role is to meet with a family, help figure out what their needs are, and help connect them with resources that they can utilize, and kind of go the next step forward rather than just kind of saying, hey, you can go to this place to get this service, good luck. It's kind of walking them through the process, helping them with any applications or filling out resumes or job applications or things like that with them until they are in the service that they need, and you've handed them off to the other agency that is going to help them with the service that they're actually requesting. These hours, it says Monday through Thursday, 9 to 5. That's just because that's when our advocate is in to answer the phone. So if you call outside of those hours, you'll have to leave a voicemail and she'll get back to you. But we do offer meetings with families outside of those hours, and we're flexible with that as well. Okay, and then for the fun side of things, we have family events that are free for families. We do 2 big ones per year, and then we do kind of mini events throughout the year. We have a family day in spring, and we have a fall event that's happening this Friday. It's super exciting. And it's free events for families. We do giveaways during these events. We have meals and fun games and things like that. It's just a place for families to come who might not have other experiences like this due to whatever reason. So we provide that space and the activities for free for them to have these fun, safe experiences. So for example, in our family day in spring, we partnered with a couple agencies and we got ski passes to donate to families. So that was really awesome because that is something that they might not have been able to do otherwise. But yeah, we just have these family events that are really great. And just ways to work together. We do tabling events. We partner with agencies and do tabling events at their places. We also have people come and table at our events when we have them. We do a lot of back to school nights and community events. We also have a classroom that we teach out of, but we don't utilize it all the time. So we have agencies or individuals who either have classes or have like workshops they want to do, and they can present at our center and utilize our service or our area for free. Then you can go to the next slide. Thank you. And then ways to refer a family. We do have this inquiry form that usually works. I will say it's been kind of, we've had some technical difficulties with it this past week. So we're trying to fix that. So if you are trying to refer a family, I would just call. Our number is the same for all of us. We just have different extensions. So our advocate's phone extension is 205. The kids zone is 201. My extension is 202. It's not on there, but I can answer any questions that you guys have, or if you send any families our way. But yeah, we just walk-ins, calls, or going through our website. And that's us. It was kind of a very speedy discussion of a lot of services, but that's the Family Support Center in Ogden. Like I said, our main goal is just to help families. Our goal is prevention of child abuse and strengthening the family unit. We work with a lot of really, really awesome families who might just be struggling a little bit and just need that extra boost of support, and that's what we're here for. So we love being able to provide these free services for our families and our communities. Do we have any questions?
Great, thank you so much, Maddie. We're so glad that we could have that kind of in-depth overview of the specific services. I know probably a lot of people on this call have heard about Family Support Center and probably even referred families there, but to get the specifics on all the different services is very helpful.
Yeah, I'm glad we can present. Thank you.
Yeah, any last questions for Maddie? If you are using the raise hand icon, all of a sudden I can't see participants anymore too. So you can just go ahead and unmute yourself and ask or throw it in the chat. All right, well, we have just a couple of minutes left, and I inadvertently skipped over a little bit of information that Esperanza from Utah Family Voices wanted to share as well too. So we're gonna just do a quick reload here of some slides. And we'll turn a few minutes over to Esperanza, and then we'll do our little wrap up.
Hi, good morning, everybody. Thank you for the opportunity. We definitely had a couple of resources we wanted to highlight with a family experience that one of our Utah Family Voices members was able to collaborate with a larger group and a larger service. And this was a parent-youth pair, a 17-year-old and her mother, who needed supports with their medical care. School needs were emerging, and they were also exploring waiver supports through DSPD and others. So if we could go on to the next slide, Athena. This was done in collaboration with System of Care, and it's the High Fidelity Wraparound. This is a service that I don't know if you've had a presentation on for this group, but if you haven't, of course you have. This is a crucial resource for those families that have the most intense needs, I would say, and that are at risk of being placed out of their own home due to the intensity of those needs, and for those that are accessing different points within the system. So if we can go on, there's a whole website around this, and this is just a snipping of what you can find on the website, but there's also a guide. If you're working with families directly and you're thinking, is this something that could benefit a family? It really goes through an explanation of the services, a referral process. It has the form on there with all the questions that are asked and the eligibility criteria. And it discusses the team approach and some of the principles that they use in order to support families. But we were lucky enough to support a family through this process, and we do every now and then attend those meetings through some of our projects. So if we can go on to the next. The parent, as you can see written here, was feeling quite emotional about the medical care that was needed for the youth and what they were going through at the time. You're going to see different things at different months in time here. It was described to me from our consultant as a rare situation where the family's pediatric doctors were not necessarily as experienced with the needs that this youth had. And just to give you some information around the specific needs. This is a youth that had multiple diagnoses, including autism spectrum disorder, POTS, anxiety, ADHD, PICC line and wound care issues, etc. So definitely complex, and the family was starting to get connected. The consultant that worked with this family and engaged in this process stepped into it. So this is not the beginning of the supports for the family as far as I know, but that's where we were in February. In March, the parent and the youth were able to receive funding through DSPD one-time funding, and Family Voices supported that family by helping them with the paperwork and explaining sort of what those services would look like and utilizing those funds on behalf of what was needed for that youth. And there were, of course, supports provided by other team members, including, and I know we have Eric here from Integrated Services. They were part of this whole process as well. We also referred internally to our education specialists. If we can go to the next slide, Athena. Our education specialists helped the family understand some transfer issues. They were moving from a charter school to a local school district. There were a lot of absences for this student, and what a plan of support needed to look like to address the different needs the education specialist was able to support the family with. And so listed here, you see that we have 12 school district specialists within the Utah Parent Center, and I've listed the districts there, 8 charter schools that we support directly, and we do have a team. I don't have them named there, but it's about a team of 7 individuals in-house here at the UPC that support statewide for any of the LEAs that you don't see listed here. And I'm using LEA, but LEA stands for Local Education Agency, and it's either a charter school or a school district. So if you don't have a dedicated support from the UPC in those local education agencies, we do have statewide support. So the family was linked to this internal program at the UPC. And if we can go to the next slide. By May, again, they continued receiving services through other team members, and they started utilizing Transition University materials that have been developed here through the UPC with vast collaboration through many partners and experts in various areas of transition. And the family started digesting it, and so did the youth. They had a lot of individualized support thanks to, again, this high intensity, high needs wraparound service. But for you to be aware and in the know about, if you're not familiar, we do have all these guides available on our website, and they're in English, they're also in Spanish. We do TU Tuesdays, the second Tuesday of the month, where we teach on these topics and may also host speakers with information, and we actually do have it in Spanish as well every month. I just don't have the schedule right there next to you, but something to be in the know about. If we can go to the next one, Athena. So between June and August, so come summertime, the youth and the parent were on track to graduate from this system of care high fidelity wraparound. They had a final team meeting in August, and there were just a lot of positive things taking place for the family. They were linked to services. They were getting set up with the school system, and the youth, with their direct support, was doing some self-advocacy and learning about their own special healthcare needs and disabilities and how to ask for supports they needed. And then if we can go to the next slide. Now we're in October, and the parent and the youth are no longer necessarily having those intensive meetings being led by that service, but it's open to them. So whatever they need, they can reach out to, and they actually came to the UPC to continue on their own, with their own ability to seek what they needed when it came to guardianship and SSI. And this is ongoing. So the reason why I wanted to highlight this, and I think this is the very last slide besides the thank you on the presentation, is sometimes we contact families at a very critical point of need, and it does take a village to be able to help them with whatever needs they have. That being said, as you see time go by and that trajectory shift with each positive step, the payoffs and the dividends are enormous. So those are the resources I wanted to highlight for you today, and the story and the case that I wanted to share. Thank you.
Thank you, Esperanza. Sorry, we kind of rushed you in at the end there, but I think you touched on some really great resources that hopefully everyone in here is aware of and using as well. So we just have a couple minutes to do our wrap up. And I wanted to remind people that you can go ahead, and if you have questions during our meeting, because we only meet once a month, to use our listserv. This is an email address that you can send questions, messages, announcements to, and it will go out to everyone on our listserv. So don't be shy about using that. We also have our UCCCN Facebook group, which I'm just going to pull up here really quickly and show. It's a private group, so if you haven't joined it yet, please join us. But we try to put announcements on there. We put information last month about the transportation survey that was being done for those with through the Utah Developmental Disabilities Council. So also a really good place to kind of do this information sharing between meetings. And then our next meeting will be on November 15th. And if anyone would love to volunteer to do our case presentation for that month, I'm always looking for volunteers. So you can either type in the chat or stay on as we're closing up the meeting here and just say, yeah, hey, I'd love to do a little case presentation. Again, we just love to hear about any cases that you've had successes with and or are still working on and would like to help kind of get information about resources like we had earlier in our brainstorming session today. So thank you, everyone, and we'll plan to see you all again in November.